All right. Well, good morning, everyone. It is 9:02 on November 23rd. Very much appreciate your participation in the call as normal. I know we got a short week this week, but there still is training, so let's jump into that. First off, this morning at 9 o'clock, there is a Bright Health Member Reward and PCP selection training. So they'll be going through all those member rewards that you have on Bright Health. So that's available this morning at 9, so you can hop off the call and jump into that. At 10 o'clock this morning, Cigna is doing their training for how to do a telephonic enrollment, completely paperless, right over the phone, so you can enroll anyone from here to California if you're licensed. So they'll teach you on how to use that. That's at 10 o'clock this morning. At 11, you got Devoted. They're doing their broker coffee and chat session. As normal, again, that's for all markets. They will help you out, but I think that's hosted by Jeanette. So either way, you can jump on there, get all your questions, concerns, or if you have a rude remark and you want them to hear it, go ahead for it. That's at 11 this morning. And 2 o'clock in the afternoon, Humana is doing their Enrollment Hub training, so you can figure out how to do your enrollments remotely and fully electronic. So that's the trainings for today. Tomorrow, we've got United Healthcare. Al and Deb Becker is doing their coffee and chat session at 9 a.m. tomorrow. That's all that's going on tomorrow. On Wednesday, Bright Health is doing their introduction to ACA. So if you're still a little shaky on how to do individual or family plans, I believe Mike is hosting this training. He's an excellent trainer. We had great feedback from him on the training sessions that we had earlier on. So, you know, if you're looking to get into ACA, Bright Health is helping agents learn how to do the business. So great training there. That's at 9 on Wednesday. And then it's Thanksgiving this week. So can you believe it? There is training on Thanksgiving, it looks like. So if you get bored with your relatives and you need to escape, Devoted is hosting their coffee and chat session at 11:30 on Thanksgiving. Not sure if that's right, but it's there. Cigna is doing their Medicare Advantage telephonic training, and the Ascension training for Ascension Complete Broker Huddle is on Thursday at 3 p.m. as well. So just check back on the calendar. Some of these may be canceled on Thanksgiving just because. Black Friday, it does look like there's a training there for Simply at 11 o'clock on Friday. But other than that, that's the trainings for the week. It is a short week this week. We have Thanksgiving, so it's going to be a tough one to get around all your appointments. But as a reminder, just follow up with those leads. Make sure that you're getting everybody taken care of, and you know, don't wait, because after we get through Thanksgiving, believe it or not, the following week is the last week of open enrollment for Medicare. So I hope you guys made a splash this year, but it is a short week this week, so really just, you know, continue to push through and get those enrollments on the board. As a reminder, November 30th is the deadline to ensure that you finish all of your recertifications. It is important that you do this if you enjoy receiving your commission renewal checks. If you do not renew or recertify by November 30th, you will be suspended and or terminated from the health plan for failure of recertification. So if you are receiving notifications on that, please make sure you get your research done by November 30th. People ask me, hey, I only had 1 or 2 or 3 sales on that plan. I don't think I'm going to recertify. Well, you know, each sale on Medicare is worth about $200 a year. So if you have 2 or 3 people, you know, is that 1 hour, 2 hour training worth $600? It is to me, but you make that choice. Just remember, you've got until the 30th. If you're unsure if you are recertified, you can call the company direct, or you can have Jessica at our office check in and make sure that you're good to go for 2021. Also, as a reminder, on November 30th, you will need to remove and destroy any marketing materials, including sales kits, for plan year 2020. So just please make sure that you get that done on November 30th. Moving forward on December 1st, all we should have in our back pockets in our cars, in our garage, in our offices is just 2021 material. So please help yourself. Don't make that mistake. That's a bad one. So make sure you get that done. All right. So on the plan news here, it looks like for Cigna, they're making some moves on their network. They announced last week that Orlando Health is now in network for Cigna Medicare. So congrats to them. That expands not only the hospital system, but also PCP and specialists as well. So they'll be adding those PCPs in network. I believe they will be effective as early as December 1st. So check back in case you have any folks that were waiting to join Cigna until they got Orlando Health in network. So now they are in network. That's 100% now. You are good to go on that. All right, Ambetter, for those that are doing individual and family, Ambetter has announced that they now have an off-exchange enrollment option. You can go through their portal to do an application for someone that is not going to go on the marketplace or may not qualify for subsidy. You can jump on there and do a quote and a full enrollment through your Ambetter portal. Again, they will be hosting trainings, so just check back on the training calendar on how to use that. Really great tool to use and a pretty simple, easy enrollment hub to make sure that you've got that going on. And as a reminder, we did add the ACA products to our app report. So Jonathan is sending out the reports every week now, twice a week on Mondays and Thursdays. So please make sure that you are checking that report, make sure your sales are accurate. But we are now reporting ACA sales, so he is putting the numbers up for that. Just please make sure you report. If the numbers look off, you know what you do. Call us or send John an email, and he can pull up the report and send it over to you as well. So just as a reminder to keep on top of your ACA sales, we want to report those so you can keep them in your CRM system. Okay, going back to Medicare here, there is an SEP that was launched from CMS for Hurricane Eta. So as you know, because of the hurricane that passed through us about a month ago, a couple of our counties got hit, and because of that, FEMA has created an SEP with CMS to allow individuals to enroll in a Medicare Advantage plan if they didn't get a chance to enroll during AEP because of the disaster. So what does this mean? You will have an extension of AEP in certain counties up until March 31st. So the rule goes again like this. Somebody that lived in one of the counties I'm going to announce here in a moment, and they did not have a chance to enroll during AEP because of the hurricane, then they will have one more chance to enroll in a plan all the way up until March 31st. So, for instance, if I live in Marion County and I didn't get a chance to choose a new plan during AEP, I can enroll in February for March 1st effective, or I can enroll in March for April 1st effective. Okay, so that's how it works. So the following counties are officially in SEP mode right now and through March 31st. These counties would include Alachua, Citrus, Dixie, Gilchrist, Hernando, Hillsborough, Levy, Manatee, Marion, Pasco, Pinellas, Sarasota, and Sumter counties. Those are the counties that are listed there. You can check your email for the full list, or you can jump on our YouTube channel and play back this video when you get a chance. But those are the counties for March 31st, effective for Hurricane Eta SEP, and that goes across for virtually all the carriers. Just check back with the carriers to ensure that they are accepting that SEP, because not all carriers do. But pretty much it looks like, you know, the west coast of Florida, Tampa market, and then cuts across to West Orlando and then north. So that's basically where the hurricane hit, and those are the counties that were issued an SEP. So for more information, check your email. All right, event guidelines and sponsorships. I know some of you are coming across events out there, and we absolutely love it when you guys are doing events. It is really important that you use events to grow your book of business, especially if you're new to the business and you don't have a lot of folks on your book yet. Events, events, events. Go out there. Find community events. Find churches. Find senior health fairs. Find a tabletop to put up, at a cash checking place. Get creative with it. Grocery stores, gas stations that are in senior communities. Maybe you can host a bingo at a senior community. All of these are fantastic community events that get you in front of your target market. Events are there. So as a general rule, we are pretty much open to support any events that you're doing as long as it's within reason. And I would say any event that's under $200 is pretty much a go for us. Anything over $200, please talk to us and see if we can participate. But we are willing to support you if you need refreshments, if you need to get materials, or you're doing a bingo and you got to get the bingo chips or whatever you're doing. Please get with us, and we're happy to help support your events in any way we can, whether we get the carriers involved or just HPM. As a reminder, we've got tents and tables and giveaways and flags and posters and all sorts of stuff out there that you can use for your events, and just absolutely incredible materials that Sergio's team has to support your events. And I absolutely think that if you're not doing events right now, you might be missing the boat, because if you think about it, a lot of these captive agents have been pulled out of the field. So these supermarkets and these doctor's offices and these sites where you normally would see an agent, they're not there. So who knows when they're going to be allowed back into the wild. But in the meantime, you might be able to get that spot. So think about that. Where did you see that Humana rep out there? Or where did you see that WellCare rep out there? And you're like, oh, shoot, that's a good spot. I wish I had that spot. Well, now is that time to go back out there and talk to those folks, because those captive agents may not be out there working for a while. So it's a good idea to start looking for those events. I understand if anyone hesitates to go back out into public with everything that's happening, but I can tell you that the agents that are doing events right now are bringing in leads. And so in my opinion, this is the one thing you should be doing. But of course, use precaution. We've got the screens, the plastic guards that you can put on your table when talking to folks. We've got masks for both you and your prospects. So we've got a lot going on to keep you safe. We've got hand sanitizer, whatever it is that you need in order to get the job done and to help people out there find health insurance. It's very important. Okay, and going into that, really, it's about, Tom was nice enough to send me some stats last week, and one of the stats that surprised me was how many Medicare eligibles are just not checking or reviewing their benefits every year. And the statistic that was in this report was showing over 57% of Medicare eligibles do not review their benefits at all on a yearly basis. So you're looking at over half of the population that has the Medicare Advantage plan or has a Medicare supplement or is on straight Medicare. They simply don't even go out there and shop. They don't look. They don't review their own benefits. And that's a huge mistake. And kudos to those agents that have reached out to your book of business and talk to them about their benefits. Even if they didn't make a change specifically, that's okay. But as long as you got there and you were able to help them and review their coverage, I think that is a phenomenal thing. That's really why we do what we do. And if you can help somebody at least review their benefits, maybe we can bring that stat down, because I think that's a shame. 57% of people are going to get a shock in January when their medications change or are not covered, or their doctor's not in network, or the benefit copay went up, or whatever, and they had no knowledge. And we usually get those phone calls in and around the first week, second week of January when people go to pick up their medications and, wow, I didn't know my medicine went up $100 a month. And that's a big thing. It's a very big thing. So, help people get educated, help people review their benefits, go out there and do that. And we were talking about, some of the marketing things that you can do. I can tell you from talking to a few agents, there might be a very big gap in opportunity to help folks. And one thing that I see is, we've talked about how to help people apply for Medicaid. Why do we do that besides helping our community? Well, really, you're out there to help generate leads too. I mean, these folks may be on the wrong plan and maybe on very, very limited income, and you help them apply for Medicaid, they get extra help, but it also opens up an SEP and they can jump on a D-SNP plan. Well, kind of similar to help people apply for Medicare. There's a lot of seniors out there that are 66, 67, 68 years old that are still working, but they don't know how to go about getting their Medicare. Maybe they're getting ready to retire. And that's a big opportunity if you can get in front of some employers and say, hey, I can actually help people, walk them through to Social Security and help them apply for Medicare. If you learn how to do that, I think you'll have a massive amount of leads because these employers, they're not privy to a lot of these moving parts here. And if you can get good with Social Security and helping people apply for Medicare, as well as the LIS program, as well as Medicaid, not only are you helping people, you become a resource to the community, a resource to your doctors, a resource to maybe even Social Security itself. I've heard stories of agents that have had good relationships with folks that work at Social Security. So I personally think that that is a huge opportunity if you're not learning how to generate leads by becoming an expert at helping people apply for Social Security and Medicare. So something to take home with you during Thanksgiving. And then the last thing I just want to talk about before I open it up to questions here is Medicare Part B and the variable costs that are out there right now, because there's a lot of different prices that I've seen. Some people are paying the standard, $144. Some people are paying less, but some people are paying more. So what's really happening with all of this? Well, the first thing that comes to mind is, if somebody's paying less on Medicare Part B, it is possible that they have extra help. So that extra help could be through Medicaid, right? Or maybe they have a Part B give back plan, and there's Part B give back plans that don't give the full amount back. Some of them are only giving $50 back. So some folks are paying $80 or so for their Medicare Part B because they are on a give back plan, but it's on a low cost give back plan. Some people don't qualify for Medicaid and they're getting their Part B covered, 100%. Maybe they're on a give back plan too. So there's a lot of different variables, but the one I want to remind everybody is your Medicare Part B is subject to your income. So if you make over a certain amount of money, and I believe it's about $100,000 per year, your Medicare Part B goes up. Actually, I think it's about $85,000 is where the cutoff is. But at those levels, there's actually thresholds. So if a senior is making more money than the average bearer, they're going to pay more on Medicare Part B. And so even if they get a give back plan, it's not going to reduce their Part B all the way, but it will help, right? They're obviously not going to qualify for LIS or Medicaid if they're making over $85,000 a year. But you can help them offset some of that cost with a give back plan. And as a reminder, almost every company now has a give back plan available to help their seniors. So that is just something I want to leave you with Medicare Part B. If you're out there and you're bumping into people that are paying a little more, a little less, we're seeing more and more of that Part B being all over the place. So just, check each one of those places. Are they getting help from a give back plan? Is it Medicaid? Is it LIS? Or maybe they make a little bit more money and they're paying a little bit more. So there's so many different variables nowadays. Just keep all of those open when you're out there and looking and helping people. I think it's very important that you get brushed up on those Medicare Part B and the cost of it that's available as well. So with that, I am going to go ahead and open it up for questions. Let's do that.
Hey, Justin.
Good morning.
Hi, good morning. It's Kim. I just wanted to ask you, can you tell me what those counties are for the FEMA SEP?
Sure, I'll read it one more time. It is Alachua, Citrus, Dixie, Gilchrist, Hernando, Hillsborough, Levy, Manatee, Marion, Pasco, Pinellas, Sarasota, and Sumter counties.
Thanks. I just missed 3.
Yeah, no worries. And then I have this recorded in case anyone needs a copy of this recording. It's going to be on YouTube. You can shoot them over, for more information as well. They need to check their email for more information regarding the SEP. And then also, please remind them that before they enroll someone into a plan.
Thank you.
Yeah, we just want to make sure that that the plan themselves is going to accept that SEP.
Okay.
Perfect. All right. Any other questions this morning?
Hey, Justin. Good morning. It's Kelly.
Hey, good morning,
Kelly. Real quick, you might want to or I'll just mention it. I know you and I talked, and I had a D-SNP that was didn't really have any kind of an SEP, wasn't new to Medicaid. So I tried to put him through for the next month effective, and it bounced back. So I know we only have about a week left here for November, but I guess don't tell everybody don't bother trying to put anybody through for a 12-1 effective. I doubt it will go through.
Yeah, thank you. And so what Kelly is referencing is, as you may know, and in your training, your AHIP.
Anyway?
Whoops, sorry. So during your AHIP training there, you should have learned that Medicaid only has Q1, Q2, and Q3 enrollment periods. You have a 3-month window in each one of those quarters of the year. And Medicare states that you cannot enroll somebody in Q4 of the year, which would be October, November, and December. So we didn't know if Medicare was going to catch on to that or, what. But what I had recommended is, give it a try. And if it doesn't go through, if the person wants to get in for 12-1, you give it a try. But if it doesn't work, let them know that you'll get them in for January 1st. So you can still get them in for January 1st AEP. But like Kelly had mentioned, it doesn't look like the carriers are going to play that game. So just be prepared. If somebody says, hey, look, I really want to try to get in, as an agent, if they're adamant about it, say, look, these are the rules, but I'll be happy to try. And if it doesn't go through, I'll come back out here or I'll give you a call and we'll redo the app for January 1st. But Kelly, I appreciate that reminder. So one more time, D-SNPs cannot enroll for 12-1 effective. That's CMS rules. They have to enroll for January 1st effective. So that's how it is, unfortunately. And then in January, they'll be able to make a change between January, February, or March. They'll be able to make one change in that quarter. And then that resets every quarter until October. So thank you, Kelly. I appreciate the reminder on that. All right. Any other questions this morning? Anything I can help with? Okay, my friends, those that I'll see at the potluck today, we will see you later. If I don't see you, if I don't talk to you, I wish you a very happy and safe Thanksgiving. Everyone take care of themselves. Enjoy your family. Enjoy the little time off that we have. and go take care of people. All right, I hope you guys have a fantastic day, and happy Thanksgiving to you.